Hello, and a very warm welcome to all our viewers to today's session on mandibular reconstruction using 3D printing. Mandibular effects can be caused by trauma, osteomyelitis, medication related osteonecrosis, tumor, radiation therapy, or congenital disease. The large mandibular defects can generally be reconstructed using a vascularized autogenous graft. In recent years, however, tissue engineering and bioprinting using 3D printing technology has emerged as an alternative to conventional mandibular reconstruction procedures. The 3D bioprinting technology helps in mandibular reconstruction based on each patient's anatomy. To discuss more on this topic, we have with us today Dr. Nakul Parashurami. Dr. Nakul Parashurami is a proficient oral and maxillofacial surgeon specializing in trauma, advanced implantology, and zygomatic implants. He's also an expert in oral oncology, temporomandibular joint, and orofacial rehabilitation treatments. Dr. Parashurami has established the dental department in Oncolife Hospital, Satara. In addition, he has presented several papers at various national and international symposia. It's a pleasure to have you with us today, Dr. Parashurami. You may please share your screen and begin your presentation. Over to you.
Hello, I am Dr. Nakul Parashurami of Canopy Dental Care, Pune, and today I'll be discussing a topic called as 3D printing, new dimension in mandibular reconstruction. So I'll be discussing a case history of a particular patient that I operated, and then going on into the various technical aspects of the advantages it offers, the disadvantages of the technique. The basically mandibular reconstruction is not just removing an ablated part and not being able to do anything particularly good to it, but it also consists of, it has various goals, which basically does that it to establish continuity, to establish alveolar height, establish arch form, arch width, maintain bones, and improve facial contour. So it is a challenging aspect for many surgeons today. Mandibular defects following ablative surgery for malignant tumors of the head and neck region impact both form and function and require a multidisciplinary approach to optimize functional and cosmetic outcomes. The goals of mandibular reconstruction are to re-establish the form of the lower third of the face and to restore the patient's ability to eat in public, be intelligible to both trained and untrained listeners, to maintain an unencumbered airway that allows freedom to perform all activities. The geometric design of the inferior border of the mandible also defines the aesthetic contour of the lower third of the face. So this is the gold standard, and it has been used is the most commonly used procedure in a mandibular reconstruction. But it also comes with its set of complications. So there was, even though free fibula is the gold standard, according to this article, which did a survey of patients, they found out that 62% females and 34% males were not satisfied with the clinical outcome of free flaps. This article also assessed the patient satisfaction on basis of post-operative complications, post-operative healing period, the amount of time required for hospitalization, etc. To discuss this case, so she was a 36-year-old female who reported from Yemen with pain and inability to open the mouth. So her brief surgical history is that she was diagnosed in 2007 with central giant cell granuloma, for which hemimandibulectomy was done and a recon plate was placed. In 2008, the iliac crest harvesting was done with use of recon plate, and the earlier recon plate was removed. In 2010, surgery was done to remove the recon plate, and these operations were performed in Egypt and in Jordan. In 2018, she started having pain while eating food and on pressing the area. So the intraoral examination shows that there was reduced mouth opening. There was pain on palpation on the operated site. There was tremendous pain on mouth opening, and a few teeth were present in the mandibular arch. There was also a deviation noted towards the operated site. There was no sign of infection as such, and there are a few maxillary carious teeth. So this was her preoperative OPG. You can clearly visualize a fracture of the harvested iliac crest. So the patient came with her own set of challenges. She was in India for a short duration. As you can see in the previous slide, she was operated for multiple times and was thus apprehensive for a new surgery which was going to last for around 10 hours, and also the prolonged healing time after the surgery. And in spite of all these things, she being a relatively young patient had high aesthetic demands. The patient was explained about the novel procedure that we were going to do, the risks involved in the newness of the technique, as there are a very limited number of articles available. And once the informed consent was taken, the planning of the 3D prosthesis was started. So I'll just briefly describe the workflow of how we went ahead in designing the prosthesis. So first, we gathered data from the from the CT scan, DICOM files, and surface scanning. Then a 3D modeling software was used to convert to CAD/CAM. Then basically designing of the prosthesis was done by the surgeon, that is me, and the engineers involved. Then the 3D printing process was done, after which the surgery was taken place. So you can see the pre-operative scans over here. We also took dental impressions and which was scanned later on. This was done so as to take into consideration the thickness of the mucosa as well. And we had to be careful that there is no accidental inadvertent tearing of the mucosa during the surgery. So that once the data was acquired, we designed the prosthesis taking into consideration the various aspects such as position of the resected cuts, design of the final prosthesis, location of the struts on which a prosthesis could be placed later on, and also we designed a resection guide which allowed for transfer of the cuts from the model to the exact location intra-orally during the surgery. So once the design was finalized, 3D printing was undertaken by the process called as selective laser sintering or layer by layer printing that allows implants to be produced from associated design files. The prosthesis used in this case was made up of porous grade titanium aluminum Ti6Al4 metal. The surface, if you can see properly, was kept rough so as to aid adherence of tissues to the prosthesis. The struts were made for the purpose of dental rehabilitation at a later date. They were of polished surface. The screw holes were designed to accommodate striker screws whose dimension was also predetermined. Now, if you see this design closely, you will be able to see that the margins are flush so as to the final prosthesis, the screws get flushed with the prosthetic surface. A routine pre-surgical workup was done. 3D printed model, the prosthesis was sterilized using ethylene oxide so that it doesn't get exposed to excessive moisture and heat. The patient was taken up under general anesthesia with nasal intubation. So these are the intraoperative photos. Submandibular incision was taken and the fractured iliac crest was exposed. During the dissection, no vessels were encountered as they might have been previously ligated during the surgeries. So intraoperatively in the first photo, you can see that the stent has been placed after adequate tissue dissection. And in the second photo, you can see the 3D printed prosthesis in place along with the screws. You can visualize the screws over here. So the cutting of the bone was done by 701 bar, and also the condyle position was assessed intraoperatively so as to not make any errors. The prosthesis was secured to the bones as discussed earlier with striker screws. So this is the post-operative photo with the drain in place and also of the 3D printed model, and you can also see the fractured iliac crest. These are the post-operative and pre-operative assessment. There is substantial mouth opening of 29 mm. There is an improvement from nil. There is a significant improvement in the facial contours, and proper facial symmetry is also achieved, which was one of the primary concerns of this young patient. Post-operative CT scans, you can visualize the prosthesis in place. So this is a 2-year follow-up where contours are placed. She is able to eat properly. Because of her time constraints, we couldn't give her an intraoral prosthesis as planned, but still she is able to manage properly and she is able to eat and have her and eat properly. So these the previous photos, they were sent by the patient as the patient cannot come back again to India. So theoretically, there can be various contraindications to not undertaking a free fibular graft. There are also various complications which include loss of skin paddle, such as skin paddle necrosis, osteocutaneous fistula, and soft tissue contracture, along with these mentioned complications. So, titanium as a metal has been used by us maxillofacial surgeons for quite some time. It is well tolerated in body. Most of the orthopedic screws, they are also made up of titanium. The infection rate is minimal. Plate fracture is less than 0.5%. And also the cases of hardware loosening is minimal. So it is one of the a very good biomaterial for replacement of hard tissues. While soft tissues, various polymers have been used. So the advantages of 3D printed prosthesis can be due to 3D printing, local anatomy is maintained. The prefabricated surgical stents make the surgery precise and hassle-free. There is no morbidity of the donor area. There is perfect reproduction of contours. Porous design allows for tissue ingrowth, faster recovery, and reduced hospitalization. The disadvantages of the technique can be discussed as there is long-term tolerance is not known as of now. The risk of exposure through mucosa or skin and what to do in such cases is also a debatable topic. It has high costs and the screw loosening cannot be completely negated, but with 2 years follow-up, the patient seems relatively comfortable. Let us briefly go through the review of literature. This case report shows two cases of 3D printed prosthesis, one in amyloblastoma and in another in oral squamous cell carcinoma. The 3D printed prosthesis was chosen as patient could not undergo a free fibula surgery. Another article, in this article, the author has performed mechanical testing of 3D printed mandible and found the material sturdy enough to withstand biting forces. So, as you can see in the photo, the specimen has endured around 10 lakh cycles of applying force between 359 and 1100 newtons without functional or mechanical fracture. So this is a landmark article of CAD-CAM recon plate. It was a multi-center trial of 30 patients in which there were 6 cases of standalone patient-specific mandibular prosthesis. So it discusses the complications and all the procedures in great detail. It's a very good article to go through. So as the technology advanced and as people got more confident, this article shows a novel technique in which in which a slot was created for dental implants. Once healing was done, a conventional stage 2 approach was done, and a prosthesis on top of this prosthesis was given intraorally using conventional impression techniques. So, briefly discussing about 3D printing. So, 3D printing is known as additive manufacturing or rapid prototyping. The concept of 3D printing began as stereolithography. This technology basically creates 3D objects by adding sequential series of thin layers and then physically creating those layers one at a time. Typically, the thickness is 0.05 to 0.3 mm. Stereolithography enables the creation of an object usually by curing a photoreactive resin with an ultraviolet laser in layer by layer fashion. Since then, different 3D printing processes have been developed for various other applications. So we'll just briefly discuss them. So the various 3D printing techniques are stereolithography, fused deposition modeling, multi-jet modeling, selective laser sintering, and binder jet techniques. So stereolithography is basically, as discussed earlier, it is a polymer cured layer by scanning laser. Fused deposition modeling is where a thermoplastic material is added layer by layer. In multi-jet modeling, light-sensitive polymer is added layer by layer and then it is cured. In selective laser sintering, scanning laser sinters metal powder layer by layer in cold build chamber. And in binder jet, there is a material which is basically used in the inkjet style, which is basically layer by layer powder is added on a platform. So, stereolithography is basically the gold standard considered. SLS, selective laser sintering, is basically what was used in our case, which it can print in metal. So, after this case, we'll just briefly discuss the applications of 3D printing. in surgery. So we have 3D printed, I have used 3D printed models. I have also used it in preoperative planning as intraoperative guides as well as for educational purposes. In oral and maxillofacial surgery, it has been used in the entire spectrum, right from implantology, facial trauma, orthognathic, as well as microvascular surgery. So this was a case done in our clinic where we got 3D printed guides. The position of the implants was predetermined, as well as the thickness of the implants was predetermined. So many of you might have also used this in your own practice. You also get such kind of such kind of implant kits which take into consideration the thickness of the stent. Does So in this patient particularly, you can see that there was excellent healing, minimal swelling, and patient discomfort. So this case did not require any kind of additional painkillers or it was a smooth operation because there was a lot of pre-surgical planning that was done. So I would like to discuss this case where in which I have used the 3D printed models uh, pre-surgery so as to just give an orientation. So zygomatic implants can be a little challenging procedures, especially in the initial surgeries. So having such a stereolithographic model printed, it always is better during your pre-operative stages. The orientation also helps in not in wrong placement, because if the orientation is misplaced, then the drill bit can enter the orbit or the adjacent soft tissue. So this is another excellent article in which the microvascular reconstructed jaws, the spatial planning was done using this 3D printing technology, virtual planning, uh, uh, along with giving a set of teeth immediately, along with the reconstruction of mandible. So it was an end-to-end surgical procedure, which is just fascinating. So you can even see that a virtual bar is designed. So imagine doing all such kind of things without having the proper orientation pre-operatively. It is an excellent, it is a game changer for such complex procedures. And as the technology is increasing, the applications and the complexity of the surgical procedure is also increasing day by day. So this is a routine planning done in which there was a huge amyloblastoma. This was a pre-surgical stent. Pre-surgical planning was done for how the cuts of the fibula are going to be. So it was a mock surgery. This is also helpful in giving up the patient a good vertical height. So this is a 3D printed stent used in orthognathic surgery. It is to replicate the exact location of the screw, which is used along with 3D printed guides, which aids in the accurate cutting of the jaws. These are patient-specific floor of the orbit mesh that has been reconstructed. for and this is now this basically gives it basically gives quicker OT time, and um, the plate can be designed as per the floor of the orbit reconstruction defect. 3D printing in TMJ replacement is also good. There are basically two types of prosthesis for TMJ replacement. One is the stop prosthesis, as well as there is a customized joint. So this was this paper discussed 3D 3D printed prosthesis in Chinese patients, and because it is patient specific, and the area of surgical site is very small, it has certain advantages in TMJ replacement. So broadly speaking, the advantages of 3D printing, and this was a very comprehensive study in which they compiled data from around 158 articles. They tried to analyze the various advantages and disadvantages on various factors. So there was improvement in the surgical time, accuracy was increased, the preoperative planning was in a much better way, and anticipation of any difficulties was also better. Risk and complications were reduced. Intraoperative guidance was we are able to provide. It has better overall patient outcome, and the paper also discussed certain disadvantages. It said that accuracy is not always predictable, but I think with as the technology advances of gathering the images, these problems can be addressed. There is a lot of preoperative time and planning is involved in such prostheses. So the disadvantages are obviously the cost, high risk complications, poor mechanical property, and it is a very complex procedure where you have to talk to the engineer, and the engineer might not understand the surgeon's perspective, and the surgeon might not understand engineer's perspective. So these are quite a bit of challenges when you actually start working on such cases. So in conclusion, I would just like to say that free fibula is the gold standard. 3D printed titanium prosthesis could work as a viable alternative to extensive procedures like free fibula in the future. It leads to shorter hospitalization and faster recovery. Cost is a major factor in such treatment modality. Long-term results are still to be documented, and proper case selection is mandatory. With that, I would like to end my presentation. Thank you.
Thank you so much, Dr. Parashami, for that very detailed and interesting case presentation on mandibular reconstruction using 3D printing technology. I'm sure it has provided a lot of insights and detailed information to our audience today. Thank you so much. To all audience members, thank you for your active participation in today's session. We will be back with another clinically relevant session next week. Thank you so much. Until then, please take care and happy doc flexing.